Malaria is a vector-borne disease, meaning it is brought about by a particular entity. In this case, it's a mosquito vector.
Malaria is a tropical disease which is vector-borne. The Anopheles mosquito, female Anopheles mosquito, has to bite you in order to be diagnosed as malaria.
The Anopheles mosquito carries a parasite known as Plasmodium, which is a type of protozoa, a single-celled organism that is able to divide only within a host cell. Plasmodium first infects liver cells as host cells, and then journeys into the bloodstream, in turn infecting red blood cells. The Plasmodium infects red blood cells by replicating within them and rotting them.
Symptoms are pretty much constitutional. You have fever, headache, body malaise or weakness, that's what you call it. So what you would observe in a person who has contracted malaria are very much similar to general infections. There'll be some variations. You would have a specific pattern in fever. You would have a cold and a hot face, that's what they call it, but it may involve shivering, those types of symptoms that you exhibit.
Even if you survive the fever, or if you have the fever 10 to 15 days later, it could affect your main vital organs, liver.
Malaria used to affect a large part of the world, but now in more developed countries such as in Europe and the United States, it does not. The United States completely eradicated malaria by 1951. However, malaria is still common today in some tropical developing regions, such as in South America and Sub-Saharan Africa. 90% of deaths are accounted in Sub-Saharan Africa. A country where malaria poses a significant impact is in Tanzania, which is in Sub-Saharan Africa. There are approximately 14 to 18 million cases of malaria per year in Tanzania. Approximately 100,000 people a year die from the fevers and chills of malaria. 80% of these deaths are among children.
WHO, World Health Organization, and President's Malaria Initiative, and many other global funds, they all pool in money, and what is called the Rollback Malaria Program. It's worldwide for these countries, where they're trying to give ITNs, or insecticide-treated bed nets, to as many people as possible. The goal in Tanzania is that Tanzanian government is making it possible for NGOs and themselves to allow these bed nets to get to at least one household. How successful is it? In practice, not as much, because there's a lot of poverty. Rural areas where it takes place are far away from main city. Poverty rates are so high, people have heard about it, which is a good thing, because they did a household survey and found that most mothers had heard about ITNs, but they had not seen it.
Malaria is among the preventable and treatable diseases, so it is just unimaginable that people continue to die from malaria. Because if we have an effective treatment that works against this disease, why do we have people still dying from it? And the main challenge is really getting these supplies available and accessible for them. In many different countries, there are different sets of treatments, because when a specific parasite develops resistance to a drug, of course, you replace it with others. So there are many different combinations, and it depends on what has been seen as the resistance pattern or the sensitivity patterns, for that matter, in treating malaria.
Mmoja nimeenda Milona kule kwa mtoto wangu. Kuna mganga mmoja kanifukuza pale. Kanaambia toa hela elfu moja. Mimi nimwambia hela sina. Mtoto kama hivi analisha mafuta tu, anakunya damu tu kwa mtoto. Wamenipa kidonge kimoja tu.
If you've seen somebody who has malaria, these people cannot work because of the cycle of fever that they have. The symptoms are quite bad. So the argument is that if you have a population, a majority of your population, a big chunk of your population affected with malaria, they're not able to work and be productive, then your economy suffers. But on the other hand, we also know that a suffering economy, an economy that does not provide good access to healthcare to their people, would also make their people prone to developing the disease, because even though you have treatment and prevention for it, if they cannot access it, you just have a very difficult way of getting rid of the disease.
In 2000, the United Nations created a set of 8 goals to develop the lower income countries called the Millennium Development Goals. The 6th goal was to reverse the incidence of malaria cases and deaths by 2015. Since then, the prevalence of ITMs in Tanzanian households has increased from less than 10% to 64% now. However, only 49% of children under the age of 5 have access to treatment. Furthermore, it is certainly possible to eradicate traces of malaria. It has been proven in developed countries that the most effective way to eradicate malaria is to develop rural infrastructure by improving drainage systems to ensure the Anopheles mosquito does not have a place to breed. However, the majority, if not all sub-Saharan African countries do not have the financial means and sufficient medical practitioners to provide more extensive measures to those infected. The fact that the quality of education is extremely low does not aid in the mission to reduce the outbreaks of malaria among those who cannot afford to pay for treatment and preventative measures. There are many organizations that have taken initiatives to help reduce the number of people affected. However, because malaria is a disease that mainly affects those who have difficulties accessing and affording medical treatment, it is very challenging to completely eradicate malaria in sub-Saharan Africa and notably Tanzania.